Thank you, everybody. My name's Joanna. I'm a consultant in emergency medicine at the Queen Alexandra Hospital in Portsmouth. And I'll start by telling you a little bit about our department. Our emergency department sees patients with severe illness and injury, and we're open 24 hours a day. We see around 130,000 patients per year. And our patients are cared for in lots of separate subsections of the department depending on their need. And that's spread out over quite a large footprint of our emergency department. And that was where the aim of this project has come from. We wanted to improve the experience that friends and family and relatives had when they first arrived at the emergency department, and they were trying to find how to navigate through the department to reach and see their loved one who's having care in the department. When a relative first arrives at the emergency department, it's quite a time of stress and worry and heightened emotion. They've unexpectedly heard that their loved one has had a health emergency. They're yet to discover the seriousness, so they're very keen to be able just to see and greet their loved one again, and we wanted to make that initial arrival experience as easy as possible for them. So we introduced finding cards. And these are finding cards, and here is an example of such a finding card. So what a finding card is at the top it says finding, and in the middle it has the title of the care area where their patient is receiving treatment. And when a relative arrives at reception, the reception team search through the database and all the different care areas to find where their patient is located. And the reception team describe to the friend and family member the route through the various corridors to go, the signs to look out for, and the name of the carer that they need to find. But now they're also given a finding card, and on the finding card it's printed the name of the care area they need to get to. Because I noticed that as soon as the relatives left reception and entered the main emergency department, they would come up to the first junction of corridors and signs and had forgotten the name of where they were trying to get to. And that's completely understandable. It's a time of worry. There's so much to think about. There's so much to remember. So the aim of the cards was to help them to remember where they're going, because now they can read their card, they can look at the sign and go, oh yeah, it was Major's A, it is down there, I can keep going. So finding cards help relatives remember the name of the care destination they're going to. The finding cards also, when they're given the card at reception, they're told that should they get lost, they can show their cards to any member of staff who will happily help them with onward direction. And I noticed that we'd often come across relatives lost, standing in the corridor, not knowing who to approach for help. Now, the naturally sort of busy and dynamic environment of an emergency department can seem quite chaotic to a visitor. And they don't really know who to approach, which uniformed members of staff they can or should interrupt, and they often feel quite daunted. So the aim of the card was to therefore allow them to be empowered to know they can just show their card to anyone who will happily help them with onward directions. And it's a bit of a ticket to say you can go to anybody, and they're really advised of that in reception. And they're also told if you don't want to speak to anybody, you can just show a card and they will tell you where to go. So finding cards really do, we notice in our departments, help relatives feel much more at ease when they enter the department. They help them remember the destination of where they're going to, and also reassure them that there will be help available should they get lost. We also, by using the finding cards, they've also improved staff experience and improved patient safety. Previously, when a lost relative understandably needed to interrupt me to ask for directions, I would need to find a computer, log in, search through all the patients' lists to find out where their relative was. And that interruption each time took a couple of minutes. Interruptions are recognised to be a harmful factor in patient safety. Interruptions contribute to loss of concentration, drug errors, and delays in treatment. So anything that can reduce interruptions to staff is really welcomed. Now, when I see someone with a card in the corridor asking where to go, I can immediately go, oh yeah, Major's A, just down there, there on the right. The interaction was very brief, the interruption was very short. The patient felt that it was just very quick to get help from me, and it helped both sides. We also find that by using the cards, because you didn't have to look up on the confidential patient list anymore where a patient was, lots more members of the A&E team could help. So security and housekeeping could help with redirections now, because all they had to do was look at the card. The finding card concept is easily transferable to any of your departments. I think it addresses a common problem. We think the layouts of our departments are quite logical, but actually, I think to visitors and patients and relatives, they can be quite confusing. It's a very cheap thing to introduce. The cards cost £25 to print 1,000 cards. So we didn't have to go through complex business case, budgeting, or recruiting or employing new staff to introduce this. We also didn't need to really do much training because the concept is quite simple. And the way we reached the team was we did short 1 to 2 minute briefings at team handovers, and we explained the current experience that our friends and family were having, and then this solution that we were bringing in. And we also emailed all the team members. And because it's quite a simple concept, we found that was actually adequate to get the project running. And it was a great way to reach our multidisciplinary team who are working shifts 24 hours a day. The project is very future-proof and sustainable. I've already noticed that we've had care areas change their names just to meet the differing needs of our patients, and it's very simple for me to just type out a new title on a card, send them for printing, and they're ready in a day or two to go. So it is quite future-proof, and whatever happens to your department, you can easily adapt and change the cards. During the introductory process, we collected feedback from friends and family and also from staff, and we had lots of very positive comments, and everybody was globally enthusiastic, just from both sides, of how much a difference the cards had made. And here is just a couple of examples of the feedback quotes that we had. And now I'd like to ask any questions. Sorry, it's a short presentation.
Super, 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 super sweet. So, yes, wonderful. Thank you. Thank you, Joanna.